Welcome to Data Saving Lives, how ODMAP can support community efforts to stop overdose deaths. My name is Merlene Tucker, and I'm here with my colleague, Jeff Bornstein, and we'll be running this Dialogue for Health web forum. Thank you to our partners for today's event, the National Overdose Prevention Network and the National Opioid Leadership Summit. And now it's my pleasure to introduce Dr. Carmen Rita Navarez, the moderator of this event. Dr. Navarez is the director of the California Opioid Safety Network and the National Overdose Prevention Network. She is the Public Health Institute's Vice President of External Relations and Preventive Medicine, Director of the Center for Health Leadership and Practice, and Director of Dialogue for Health. Welcome, Carmen.
Thank you, Marlene. Good morning and good afternoon to everybody, and welcome to this really great session. I want to tell you a little bit about why we're doing this. Can you advance next slide? Thank you. We're going to take a deeper look today at ODMAP. This was one of the sessions presented last month at the National Opioid Leadership Summit. The summit, presented annually, is a gathering of healthcare, justice, and prevention sectors, showcasing best practices, showing collaboration between these sectors and how it saves lives. You can view all of the plenary sessions at the website listed right here on the bottom of the slide, knowles.dialogueforhealth.org, and we'll repeat it again at the end. Next slide, please. So the National Overdose Prevention Network is a product of what has happened in California and other places where we had an opportunity to see what are the kinds of things we can learn if we bring sectors together, if we are able to really get the best conversations going, give people the support that they need in order to make their work on the ground the most valuable to their communities, the most impactful. Because of the work we've done, we've had the opportunity to work with 125 communities in California, serving approximately 33 million Californians. We know what we've learned about driving local change for complex problems, and the ingredients are strong partnerships, leveraging assets already in the community, working across sectors, bringing everybody to the table, adopting what works, and not reinventing the wheel. We also know that stopping overdose deaths requires collaboration from a really broad set of partners. And this wheel here on the left just gives you a sense, please, if you'll please advance next slide, thank you. The wheel here on the left gives you an idea of some of the sectors that we know we need to have at the table, that we need to structure these conversations and make sure that they happen. Once we've got conversations structured, we find it's easier to develop a local response. It is more effective in strengthening systems, and we know that over time, we get better at sustaining our action. Next slide, please. People from all over the country are working to prevent overdoses within their community. The best practices in overdose prevention, working smarter and more effectively together with your coalition, communicating for impact, making data-informed decisions, and planning for sustainable programs and services are what the elements of this National Overdose Prevention Network bring. Next slide, please. We bring a series of skills that make coalitions function better, but also we bring to you a number of the strategies that we know are critical to preventing overdose death, preventing new addictions, managing pain safely, treating addiction, and stopping overdose deaths. All of our sessions highlight one or several of these strategies, and these are all evidence-based strategies. Next slide, please. We ask you to join us to learn from others and share your experiences, best practices, and tell us what you want to hear about. Help us enlarge this network of people across the country working to prevent overdose deaths. Next slide. It is my great pleasure to launch this, this really important, really interesting session. And let's start with the introduction first. Sergeant First Class Retired Mark Karandang is going to be speaking about the ODMAP program. And next slide. We have Reb Close, who's a physician practicing at Community Hospital in Monterey Peninsula, who's worked quite closely with Mark and has had a really good experience. We'll share why this particular approach matters and give us some good examples of the kinds of ways in which they've been saving lives in Monterey County. So with that, I'm going to turn the mic over to Mark.
Hi, good morning, good afternoon, everybody. Just 1 second, let me share my screen with you all. Are you guys able to see that?
Yes.
Okay, perfect. Thank you so much, Dr. Carmen and Marlene, for the introductions. Again, yeah, good afternoon for those in the Central and Eastern time zones, and good morning for those in the Pacific time zones. My name is Mark Karandang, and I'm the Drug Demand Reduction Coordinator for the Northern California High Intensity Drug Trafficking Area, or HIDTA for short. On behalf of my director, Mike Senna, and Deputy Director, Karen Sherwood, thanks again for the invite and giving us the time to share a valuable resource with you fine folks. Essentially what I do is to synchronize efforts between law enforcement and public health and safety agencies to make our communities better resilient to the disease of addiction. My other role is to educate and to raise awareness within our law enforcement partners about the true nature of our national drug control problem. Our national strategy is two-pronged, cemented by a very important foundation. Does anybody want to guess how much fentanyl powder was seized by our national HIDTA program in 2019? I don't know if you can see answers in the chat, but I'll give you guys a few moments to see if I can get any guesses with the amount of fentanyl powder that was seized in 2019. Actually, spoiler alert. 3.6 tons of fentanyl powder was seized in the United States. This is enough to kill all Americans in the country many times over. So, the first prong as part of our national strategy is the disruption of the supply of illicit and very dangerous drugs. The majority of HIDTA efforts is law enforcement based. What me and my other drug demand reduction coordinators or colleagues offer is another perspective to this very diverse team. Now, 3.6 tons is a huge win, something to be incredibly proud of, especially with the potentials of lives saved. I always raise a very, very important question to my other colleagues. Do we have a drug supply problem, or do we have a drug appetite problem? So the Substance Abuse and Mental Health and Services Administration conducts one of the largest national surveys on drug use and health. The most recent report from 2018 detailed that approximately 50 million people aged 12 and older have used illicit drugs in the past year. The second part of our national strategy is to prevent new initiates from going down a path of addiction. What's especially concerning and alarming is that, approximately 1/3 of those suffering from the disease of addiction is seeking treatment. As we all know from, disease and prevention science, the disease of addiction is treatable. And so the foundational piece, as mentioned previously, is really to increase capacity of, available treatment to those suffering from addiction. One thing I wanted to share with you folks as well is our national drug control strategy. These two documents will be made available via the Dialogue for Health webpage, but I really wanted to highlight some of the successes of the previous administration. The Trump administration did an outstanding job of really highlighting and putting to the forefront the importance of prevention and treatment. And so, the second component to the document is the fiscal year 2020 budget and performance summary. The federal government has allocated upwards up to $30 billion to fight our national drug control problem. And understanding where those federal dollars are allocated may provide opportunities for potential, grant funding. So the most recent National Drug Control Strategy, which was published by the Office of National Drug Control Policy, came out in February 2020. Normally, this is an annual document, but with the new incoming administration, we don't anticipate a 2021 national drug control strategy yet until potentially 2022. We have a new administration, new staff. It'll take them about 6 to 9 months to get their priorities in order before they're able to produce a national drug control strategy. What I do have, though, is a kind of a teaser, if you will. Last month, the Office of National Drug Control Policy Office provided a roadmap for the incoming administration outlining specific activities for the first 100 days. And again, this document will be provided to you all via the webpage. One of the things I wanted to highlight in terms of specific activities for the first 100 days was the lifting the ban on spending federal funds on syringes for exchange programs. This is something definitely to be excited about for the new incoming administration. So we are here to talk about ODMAP, the near real-time overdose surveillance tool available to public health and safety agencies in tracking overdoses in real time. I would be remiss if we did not mention COVID. It is becoming quite clear that the national, global pandemic is resulting in increases in overdoses, at least nationally. This pandemic has highlighted the value of a public health-led initiative in combating against a threat to public health and safety. Contact tracing. I'm sure there is not anybody on this call who has not been in contact with a tracer due to possible COVID exposure. What about analyzing heat maps of COVID exposures? In California, whole regions of our state has been effectively shut down because of data made available from heat maps. So with everybody on the call, I raise a very difficult question for all of us to ponder. Why has there not been the same level of public health safety-led effort in addressing a crack epidemic in the 80s, heroin and meth epidemic in the 90s, and now to our most current epidemic, the synthetic opioid epidemic? Our multi-generational drug problem has killed more Americans, impacted more families than all of the leading causes of deaths many times over. Fact. Marlene is going to introduce a poll, real quick, simple 8-question poll, because I'm curious to know everybody's thoughts on having access to relevant and timely overdose data. So for central themes we are going to talk about this morning, we're going to talk about, the genesis of ODMAP, why ODMAP is needed. We'll talk about the history and future of its development. We'll go over user interface. And then lastly, my colleague, Dr. Red Close, will talk about, what can be done with having access to data. The first question that I'm going to address right off the bat, and this is something I get asked quite often, is, the HIDTA program, why should we collaborate with a very law enforcement centric organization in terms of tracking overdoses in real time? What sets the National High-Intensity Drug Trafficking Area program from the other federal drug control agencies is our dependence and level of collaboration, cooperation, and partnership at all levels of government, state, local, federal, and tribal. If it were not for this collaborative effort, the HIDTA program would not be as successful as it is, today. And so, due to our, collaborative, business models in HIDTAs across the nation, collaboration is something we do in terms of working with, with Esri mapping software. This was our way of giving back to public health and public safety in order to address the single identified obstacle in getting a better handle of our opioid epidemic. And that, ladies and gentlemen, is, the sharing of relevant overdose information in near real time. Common concern amongst a lot of people is, well, if law enforcement agencies has access to the information, are folks going to be arrested? Nothing can be further from the truth. What we know about, overdoses as they occur is that, they truly are not a victimless crime. It's quite alarming that the majority of overdose victims are unaware that the very potent and deadly analog of fentanyl is part of their supply chain. And the reason why I know this is because we have tremendous partners within the harm reduction, coalition sectors. A huge harm reduction message is to, if you're going to use drugs, at least, take, fentanyl test kits to see if any traces of fentanyl are in your supply. Sadly, these fentanyl test strips are not widely and readily available to everybody. But a caveat to that is Narcan is widely and available to everybody. So, law enforcement aim is not to arrest everybody who overdoses, on drugs. Law enforcement aim is to really disrupt the supply of these deadly drugs that are permeating our communities. Because when 20 folks overdose in a single weekend in San Francisco, for example, that will certainly raise some concerns because that now is an identified threat to public health and safety. So the HIDTA, the National HIDTA program, Bill, we have upwards up to 30 HIDTA regions nationwide. This is just a resource for you folks to tap into. If you're in a HIDTA region, definitely check out the webpage. Some of the benefits of your county being a congressionally approved HIDTA region is access to more resources. We have 3 outstanding national initiatives: the National Marijuana Initiative, the Overdose Response Strategy in conjunction and partnership with the CDC, as well as the newly cemented ADAPT, which is for a division of advancing prevention and treatment, which is a HIDTA-backed prevention initiative. So every community in America is affected by substance abuse disorder and its challenges associated with responding to fatal and non-fatal overdoses. Something that's been lacking has been a truly coordinated, deployed response. As mentioned previously, the biggest obstacle that we needed to cover was the sharing of relevant data. And again, I'm curious to hear your responses from the poll in terms of if you have access to this very, very important piece of intelligence, that helps you during the course of your day-to-day duties in protecting our communities. A key factor in saving lives is this collaboration. And so our partners in Washington, Baltimore, HIDTA, they manage the ODMAP program and provide tremendous resources to local, state, tribal, and federal public safety and public health agencies. A couple examples of those agencies: law enforcement, fire and EMS departments, hospitals, medical examiners, and criminal justice and public health personnel. These are all examples of agencies which can sign up for access to ODMAP. There has been challenges related to timeliness and accuracy of reporting overdose deaths, which make it very difficult for first responders and public health professionals to respond effectively. For often to not, overdose data is, delayed by months up to years, pending toxicology reports, number one. Number two, we still have, informational silos within various public health and public safety departments, which are just not sharing the data for whatever reason. And so, ODMAP is the stopgap to this obstacle. In terms of HIPAA goes, ODMAP is HIPAA compliant because no personable identifiable information is shared within this program or within various public health and public safety agencies that are partnered in using this program. So ODMAP is relatively new. It's only been around since 2016. The Washington Baltimore HIDTA was invited to a meeting of medical researchers, drug court judges, and public health, fire, and EMS officials to discuss approaches for dealing with Baltimore's, rising opioid epidemic. And so, what was happening in Baltimore at that time was not unique to Baltimore. And so, based off of the lessons learned from that work group and our tremendous partnerships with the Esri mapping software and the various other law enforcement agencies nationwide, ODMAP was born in 2016 and fully implemented in 2017. Nothing can be more truthful than by building collaboration begins by building trust. And the only way to do that is to overcome our selfish needs of withholding information. So ladies and gentlemen, ODMAP is the fruits of that working group's labor. ODMAP is two interfaces. We have the level 1 interface, which is where people would input the data via smartphones, tablets, computers, any device connected to the internet. And then the level 2 interface is, where, folks are able to analyze the data to figure out where and how often overdoses are occurring in their communities. This program was first made available in 2017. The number of user agencies has grown from 136 to over 3,000 in 1,000 counties across the United States. In the past 2 years, ODMAP has not only expanded the number of communities and users, but the types of agencies using the platform for analysis have expanded. Initially, it was very heavily law enforcement-based agencies sign up, again, just due to the fact of our, tremendous law enforcement network partnership. But something that's happened 2 years since is that, public health and treatment has slowly gone on board as well. This is a snapshot of California and where we're at with our ODMAP efforts in our 58 counties. And what you're unable to see there in those small white print that, more than 70% of all agencies signed up are in public health and public safety, rounded out by law enforcement sector agencies. So this is the level 1 interface. Real quick video. This is how fast, how easy the user interface of the application is. Very, very efficient. Using technology nowadays, it'll take no more than 10 to 15 seconds to be able to input a suspected overdose on this map. And this is a real-time video of that very little effort. And when you multiply this effort, the hundreds to the thousands of times of overdoses as they're occurring, this translates into powerful data that can be analyzed on the level 2 dashboard, as you can see here. And so, just a reminder, only federal, state, local, tribal governmental agencies serving in the interest of public health or public safety may register for ODMAP, and this is including EMS entities and hospitals. Once these agencies are granted access for using ODMAP, it is up to them to be able to, to grant access based off of who needs to know. An example, if there's a, drug-free coalition or a community-based organization who has a tremendous working partnership with a public health agency, that public health agency can grant access to that non-governmental agency, based off of a need to know. The HIDTA program, delegates that responsibility to that initial agency signing up. And this is all outlined in the end user agreement between Washington Baltimore HIDTA and the participating agency. More information can be found on our main webpage, www.odmap.org. And here is where you'll be able to access or request for access for ODMAP. Go to the main webpage, request agency access. Once that's done, actually, before that, so this is the requesting agency access. It's a simple online form. Basically, we need to identify an agency point of contact as well as an agency administrator. So at a minimum, 2 people with, again, point of contact information. Once this form is submitted, a unique agency code is then emailed back. Folks will need this unique agency code when they sign up to get access to ODMAP within that agency or organization. So here's where you would need that that agency code. So lastly, We spent, some time talking about ODMAP, how it was developed, how to grant access, how to use ODMAP. That's part one. The second part of ODMAP is really the playbook. And so the Washington Baltimore HIDTA provided this playbook to help multi-jurisdictional agencies collaborate and implement ODMAP as a, to be part of a framework in terms of a community overdose response. And it highlights, the 5 main points of why ODMAP was developed: to connect agencies, share timely and relevant actionable information in order to provide a appropriate community level response, to evaluate if those strategies are sound, and lastly, to prevent unnecessary death from overdoses. Ladies and gentlemen, that concludes my short time. I'm going to pass it over to my colleague, Dr. Reb Close, to really talk more in detail about how her organization uses the ODMAP platform. It is not only my honor, but it's also my privilege to introduce you to one of our dear partners and huge ODMAP advocates in the state of California. She is one half of the dynamic duo of a dedicated husband and a wife physician team dedicated to reducing overdoses in their communities. I first met Dr. Reb Close at a local high school town hall meeting on drug use back in the spring of 2019. And then we ended up co-presenting at last month's National Opioid Leadership Summit. And here we are today. Again, great honor and privilege. Dr. Reb Close, go ahead and take it away.
Thank you, Mark. Thank you so much. Thank you,
You're
everyone.
welcome.
I appreciate everyone being here, and I thank the organization for making this presentation possible. I'll go ahead and share my screen. Is that coming through properly? Cool. Okay.
Yes.
So thank you again. It's an honor and a privilege to be here and to share our information, and hopefully it will help other communities, because our community had a pretty intense experience that I would like to share and show how this software has really made a difference for us and given us power to react. So again, I'm Reb Close. I work at Community Hospital of the Monterey Peninsula. I'm a full-time emergency physician. I'm also a regional director for the Bridge to Treatment program. And you'll hear references to CHOMP. That's the nickname for my hospital. So if that helps explain what I'm referencing. And so we created in 2013-14 in response to the drug overdoses, and at that time it was mainly prescription drug issues we were dealing with, we created a Prescribe Safe initiative. And that's a collaboration, and I'll show you the partners in that collaboration on the next slide. But part of this has been physician education. We've done CME events. We've given prescribing guidelines. We do resources for complementary medicine. I mean, we're addressing in Carmen's Wheel, we're addressing a lot of those things with this initiative. We have resources for patients, educational materials for families, drug take-back options. We work really closely with law enforcement. We've been a strong proponent for getting naloxone into the community through town hall events, through police distribution, through EMS. We've really been working on a multifaceted approach. And the important part is that collaboration that has been already mentioned. And so going to my next slide, I'll share with you, these are our collaborating partners. And so we have all of our drug treatment programs. We work with our faith-based communities. We have our pharmacies on board. This is a community effort. And this becomes important because this effort has made it possible for us between 2014 and 2018. We went from well above the state average for opiate overdose deaths in our community to far below. And this graphic just explains that. And the star on there is when we came together as a collaborative team to start making those changes. And so they were incredibly effective. And we were really seeing some changes in what was happening to our community members, to the families, to the loved ones. I mean, this was tremendous, and we were incredibly proud of all of this work. And you can see here on the opioid dashboard information that's available from DHCS, Monterey County was well above the state average and in about the top third of counties most affected and having the highest age-adjusted opioid overdose death rates. And then as you see on the right slide, I mean, we are second from the bottom of all reporting counties. And that timeline is 2012 to 2018. So this again was something that we were working really hard on. We were doing a lot of outreach. And then something happened. And so in June of 2019, one of my physicians notes that there was a patient that came in that the patient said when we woke them up with naloxone, you know, the reversal agent for an opiate, they said they'd only taken half a Percocet. And, you know, as an ER doc, we know that is not the action of half a Percocet. It doesn't make any sense. And so we put out our radar of something's going on. Something's bad in our street drugs. And so then the next case happened, in July, we had another case come through, and that patient for a Percocet overdose required multiple rounds of naloxone. They were placed on a naloxone drip. They needed IV reversal agent on a continuous fashion to keep them alive. And that's just not a Percocet, you know, as we just know that. And so we were really starting to pay attention to try to figure out how to gather enough data to know what we were up against. Well, unfortunately, that patient then ended up in my coroner's office. And prescribed safe, we work really closely with our coroner's team. And so we were able to get the formal toxicology information and found out that it was fentanyl. And so that's when we were finally able to confirm what was happening. We didn't even have fentanyl testing capabilities in my hospital at that time. This was, you know, learning what was happening as it was happening. And so we were trying to figure out how to address it and what we were going to do. And then what I call fentanyl weekend happened in my small community. And in October of 2019, we had a fatality from another Percocet overdose. This was in a teenager. And that weekend we had 10 fatal and non-fatal overdoses in my community. And truly, that weekend we called every member of Prescribed Safe and we pulled an emergent meeting, and Mark was there. And we were talking about, okay, what are we gonna do? Something horrible is in our community and how are we gonna respond? And somebody asked, well, hey, are you guys tracking this? And we're trying, we don't know how. And that was how we got introduced to ODMAPs. And so I will show how that collaboration has moved forward, but now you know the why. Why did we jump at any ability to know what's happening? Is we had to, because this is what we were seeing. And so this slide is something everybody's pretty familiar with. The fatal dose of heroin for an average adult is on the left, and then fentanyl and carfentanil on the right. My street chemists have no way to know how much fentanyl they're getting into each of these Percocet or now Xanax or our cocaine, or it's all through our drug supply. But where is each of those granules showing up in that particular pill? So my patients now are taking a quarter or an eighth or a shaving of it. Where's the fatal dose? And the fact is nobody knows. So unfortunately, this is a national issue and we aren't the only ones affected. Now, granted, we're still below the state average, and this is the most recent data that I pulled up about a week ago, but that's because the state average has changed so much. And so if you'll notice on the prior slide, compared to this one, they actually had to change the y-axis to get all of these fatalities documented. So this is a big problem, and we have got to come up with a communicated and well-coordinated response. And so what did we do now that we could start tracking things and kind of following up what's going on? We, in response to Fentanyl Weekend, we did public health notifications, we did media and public outreach. We pulled all of our collaborative teammates together to talk about what was happening, to bring people together. Again, as I mentioned, getting town halls together, getting naloxone in the community, any outreach, any way. And now all of that is, of course, via Zoom or dropping things off in socially distanced locations. But we're still continuing this work. But ODMAP has made a lot of our new work possible. And so moving forward, as you can see, so here's in response to Fentanyl Weekend, I went back and I put in, because I track our overdoses anyway, as part of our prescribed safe work, trying to get the word out and know where to do our community outreach. I was already doing that work. And so I went back and I added in September and October to ODMAP just for my hospital. This is my hospital alone. And then we moved forward and we pulled in all of our coroner's information that we had available at the time for 2019. And you can see here, it's all across the county, and these are my fatalities. This is not just fentanyl. These are all of my overdose fatalities, but you can see how seeing these data points and being able to figure out where the clusters are. And if you can see off to the right, you can sort it by date, you can sort it by fatal, you can sort it by naloxone, you can sort it by drug. That helps me know what I'm up against and what I need to do in response. And so we pulled in the 2019 all fatal, and then we have the October to December non-fatal, just from my hospital, one hospital information. And here's what we were able to see and to find and to look at as far as where do we put our public health efforts, where do we put our outreach, which of our drug treatment programs do we really reach out to for help. And so here's our 2020 partial data, and ODMAP's just updated. And so as you can see off to the right, I was able to select by California, Monterey, incidents between 1/1/20 and 12/31/20. This is what I have so far for 2020. And as Mark mentioned, a lot of the coroner's information isn't available for a significant lag time because of all the research that goes into those cases. But these are lives, these are our community members, these are our families. And so you can tell in looking at this data, when I'm asked a question, okay, what are we seeing? Let me just tell you. And literally I go to this software, pull up the information I'm asked for, and I have it for whomever needs it for their efforts. We've used this for grant applications, for public outreach. This is how I keep an idea of what's happening in my community. So what are we doing in response now that we have the data, or now that we're able to get the data? Well, so of course we do direct community outreach. Literally, when we see a hotspot or when we get an alert that we're getting a spike, I will contact the law enforcement agencies, the chemical dependency treatment programs in that area and say, hey, you guys, something bad is in the drugs right now in your area. Please, tell us how we can help you. Do you need more Narcan? Do you need more tip cards on SUD services? What can we do for you? And so the direct community outreach is a big part of it, as well as to the treatment programs. We have social workers, literally, that will take, we have a various homeless community populations. And if we see a spike there, literally we arm our social workers with resources and Narcan and get out there. Please, please help these people. And we will find the used Narcan in the encampments, and we're grateful that those lives have been saved. And so this is how we've done the outreach. Literally, we asked one of the chief of police in Carmel, hey, do you want to hear about spikes that are happening in other areas of the community? Absolutely, because when it's there, it's coming our way next. And so it's just really nice to have this data to be able to so easily and rapidly share. So that's how boots on the ground, our hospital, what we were up against, what happened, the changes we'd already been able to be made, already had been able to make, the partners we had, and how out of need we were able to use this new collaboration with ODMAPs to really improve how we respond in our community. So I thank everyone for this time, and I am very much happy to take questions, and I will stop sharing my screen. Thank you.
So thank you very much, Mark and Reb. I think that was a great intro to some of the questions that are actually, you've already answered some of the questions that have come up from our listening audience, but I want to go back to a couple. One thing is, Mark, could you talk a little bit more about where you have been able to work with folks? For example, there was a question, I know this is not in your region, but how would somebody in Connecticut find out if ODMAP is available to them? And could you speak to what tribes you've worked with in California?
Yeah, absolutely. So ODMAP is available nationwide. in every state, all 50 states. So it is available in Connecticut. Again, just please check out the webpage for how to get access to it. In terms of tribes, specifically to California, we have collaborated and partnered and provided resources to the California Tribal Epidemiology Center, TEC for short. To my understanding, they're the governing body of all California tribes in terms of public health and public safety. But if individual tribes in California or in the rest of the nation are interested, please check out the ODMAP main webpage.
Thank you for that. Now, there's been several questions about this. I'm going to try to collapse them into one. And anybody who has a question, please type it into the Q&A at the bottom of your screen. What is the arrangement between the High Intensity Drug Trafficking Agency and the agencies on the ground? What kind of obligations are there created by an agreement to share this data, and who can enter data, and where does the data come from? And maybe both of you can speak to this.
Yeah, absolutely. Because this is a governmental system, there are some user-end agreements. The data collected is federally classified as controlled, unclassified information. That is the federal government's way of safeguarding this information, and why the general public does not have access to this information. As part of that end user agreement, it is specifically laid out that the data collected in ODMAP should serve in the best interest of public health and public safety. So it's pretty broad in terms of what is required. Obviously, we don't want drug trafficking organizations to be able to have access to the information because they don't want to know how, their products are impacting the communities in a negative way. All this, again, can be found on the main webpage. I do know that our end user agreement has not been a hindering factor in getting public health and safety agencies signed up with ODMAPs. If I can, I saw several questions about, how about non-governmental agencies with a charter in making sure that, public health and public safety is properly taken care of? And maybe Reb, you're able to chime in a little bit. But I know, through Reb's, Safe Prescribing Initiative and her contacts with the Community Hospital of Monterey Peninsula, they have tremendous partnerships with various community-based organizations. These are non-governmental public health and safety agencies. They have granted access to ODMAP under their account because of that formalized partnership between hers and their organization.
Yeah, and that's absolutely true. Is we work with our partners. They're part of our organization, and we input information. However, whoever has access to the information. And I saw one of the questions was about duplication. And we see that sometimes. So if law enforcement inputs an overdose and then it comes across my desk through the ER, if I go to put in that overdose, sadly enough, it may be days to weeks later, because if it comes through that channel, it's a little slower. If they've already put it in on scene, when I go to put it in, I will get a duplication error. So that is something that I wanted to address in the questions, but it goes to show that various partners are able to as well put in data as we all work on the same goals.
Yeah, a couple of things I want to make sure that I point out. The work that that Reb is doing on the ground is actually a part of the work done by the coalition in Monterey County. And this is a really good example of why coalitions matter and why it matters in trying to save lives, bringing all the different resources into one place to share information and to really work out what are the strategies that matter in order to make sure that people don't die of things that they don't really even know that they're taking. And I think maybe getting to that issue, there were a couple of questions about test strips that I think are worth answering here. Are test strips active for all analogs of fentanyl? That's one. And then the other one was, do you have any evidence about whether people are using test strips in order to seek out fentanyl instead of avoid it?
Yeah, I'm happy to start fielding that. So The analogs, unfortunately, even the labs have a difficult time with all the various analogs. So I don't trust that we are ahead of the chemists. So I use, my recommendation for fentanyl test strips is all harm reduction is good in whatever way it can be used. And so I don't deter from it, but I try to understand the limitations. And one of those limitations are the various analogs. And another limitation is that people are seeking fentanyl. That's true. And so that may be kind of an incentive. Okay, we know we have some fent, but it goes back to what I was saying about my street chemist and any particular pill. Where's the lethal dose? And the answer is you don't know. So if I shave off a little piece of my pill and I test it and it tests positive or negative and I choose to use another part of that pill, I still don't know what I'm getting. I have no clue if that's a fatal dose. And so that's been my hesitation to really work towards getting test strips. You know only that little part that you tested. You have no idea what's in the rest of your product that you're about to use.
Yeah, very good. One good question here is, are you using any social media to talk about the kind of success that you've had, or to really help inform the community about what's out there when you're seeing something?
Yeah, we work closely with our communications and marketing team. I am the least social media active person on the planet, and I'm good with that, but my communications and marketing team is amazing. And so they reach out to me, I share with them what I know, and they make sure to do various outreach with it. We do a lot of media updates. And I think 2 days ago I was working with a web designer that our organization is changing to update our website. And that's truly, we keep all of our data. I see somebody was asking for tip cards. They're on our website. And it's a little clunky right now, and we're modifying it, but everything we have is there. And I would invite any of our resources. So what are the dangers of opioids? Why am I getting a prescription for naloxone? You know, because people wonder and they don't know why are you giving me this prescription? All of that's on the website. If anybody wants it, can use it, it doesn't matter. Steal it, take it, rebrand it, don't rebrand it. I don't care. I want that information available to anyone who needs it. And so how I find the website is I type in Prescribe Safe Monterey and it comes up for me. The formal website, and I can put it, I guess, actually if somebody can put that in for all the attendees to have it, but the montagehealth.org/prescribe-safe. And then my email as well is available if you have any direct questions, because I want this information for everyone, because it's hopefully going to save lives.
That's super good, and we'll also provide that link in the when we upload this conversation, because this is being recorded. So we'll have, if you've missed it, if there are parts that you want to hear again, you want to share this with others, we'll have it up on our website, and you'll be able to download or send it over to folks. So the other thing that I think is a very good question is the data in ODMAP show where naloxone was given? Does it help you understand who's actually giving the naloxone, the first responders or in the hospital, and how might that information be useful?
Yeah, so that is one of the fields of query that folks can analyze ODMAP for. You know, how often is Narcan being administered? Is there a Narcan capabilities gap within a portion of the community? And so a lot of valuable analytical tools in terms of overdoses and how they're impacting the communities are available.
Mm-hmm. Really good. So let me just go back to something. When we were preparing for this call, Reb, you gave a really good example of how you were able to see the impact of ODMAP with respect to your work in the homeless communities. And I wonder if you'd maybe go back to that and how to do with naloxone, just to give you a little reminder.
Yeah, and that's what I was mentioning. So we do have our social workers go out to our homeless encampments, and they provide naloxone, they provide the tip cards, as I mentioned, and other resources. And they will find just boxes and used naloxone product in the encampments. And it's one of those things that you see that it's being used, you see that it's saving lives, because these patients don't even end up coming to the ER. These are the unknown saves, but yet we're seeing the evidence of it. And I hear that from all of my social work teams and as well as our law enforcement teams when they go into our encampments. That's where they're finding the used naloxone that we're distributing to the areas of highest need. And how we're finding that is, if my drug treatment program here was about, yeah, I need more naloxone because we saved a couple of people last night, you know, that's that data. That's the only way that data is even captured, but we can still respond to it.
Really good. Thank you. I want to ask, you know, I think that there's a lot of interest here in trying to figure out how could communities understand why ODMAP would be useful to them. And so, Mark, let me just ask you, is there a look-only site that County Behavioral Health Advisory Board members would be able to look at in order to gather information, learn more about this? How do you advise people who are interested to find this kind of information so they can kick it around and see if they really want to enter into a relationship with you?
Sure. Get access would be the only way and the most efficient way is to get access. You can get access to ODMAP. Just because you have access doesn't mean you necessarily have to input data. But being granted access allows you to view the data. No other way around other than to request access to ODMAP.
Okay. Maybe one of you can answer, is there any way to show the impact of over-the-counter naloxone as proposed on OD mapping? Do you get any information about whether people are using naloxone that they've purchased over the counter? Is any of that trackable via ODMAP?
In ODMAP?
Yes.
Go ahead, Mark.
Go ahead.
Oh. In ODMAP, okay, your turn.
Sorry. In ODMAP, you have the ability to be able to identify the person who administered Narcan, whether it was first responder, law enforcement, hospital staff, or a public person. So you're able to query that information in ODMAP.
Reb, anything you want to add?
That's what I was going to say, is when you are inputting the data, it's right there, you know, bystander. And so that would be, you wouldn't be able to know if a bystander had received it as a prescription, if they had received it over the counter, or if they had gotten an ER distribution. You know, in my ER, we literally hand out naloxone to patients and families in need. So you wouldn't be able to know that level of detail, but you would know if it's bystander administered.
Yeah. So Reb, you're really busy as an ER doc. This is a really good question. How did you get other docs? What are the ways that you get other docs to be interested in this? Because, you know, clearly you want to have the medical profession engaged in this. Otherwise it has limited use.
Right. It's the why. I got to be honest. Watching the patients, the families, and the community suffer, we went into medicine to make a difference and to help people. And this is a direct impact. When you see someone come in from a near fatal overdose and you are compassionate with them and you are grateful to them for someone on scene having naloxone and being able to save their lives, and you have that connection. And then obviously prior to COVID, their family comes in and you talk to the family and you can hand them naloxone and you can offer them treatment. We have treatment options now. It felt like for a while we had nothing to offer. Now we have a lot to offer. And so, you know, I remind my docs, because, you know, the daily grind, especially adding COVID to this mess, the daily grind is painful, but you can make a difference. And I got to be honest, a lot of these are our kids. I'm following our youth overdoses right now. These are our kids that we're losing. And so it's so close to home. One of our physicians that unfortunately had a pediatric fatality, his child was of nearly the same age. We are seeing this in our community and our families, and it just matters. So you just remind them that they have something they can do and what they're doing makes a difference.
So one of the things I want to tell y'all, both the audience and the panelists, is that we have 43 questions, and clearly we didn't have the time to get to all of them. But I've never seen so many questions. I've never seen such really strong interest in a program that I've done before. And so I would just want to really thank you for having the opportunity, for you taking time out of your day to do this for this audience. Hopefully we'll be able to have some additional sessions on this in the future. One of the things I'd like to just ask, because it's really critical to many of the people that are on the line, what is the cost to utilize ODMAP?
Just time and effort.
So it's free.
It's free.
Yeah. I think that's really important. Can ODMAP differentiate between illegal drugs and prescribed medications?
No, that's one of the limitations of ODMAP. We just need to keep in mind that it's not an official, COGS report, if you will. It's just, a real, real quick pulse check of how addiction is impacting communities. Carmen, if I can, there was one question I really wanted to highlight, and that was from Sarah. She had asked, she asked a question about, harm reduction folks, about getting overdose data from harm reduction coalitions. And, this is I know we have 3 minutes left, but for everybody on the call, in terms of communities being impacted by, the drug opioid epidemic, do we have a complete true sense of what is happening in our communities? Right off the bat, the answer is no, because the majority of our data that we're using to make those assumptions is from EMS data, hospital data, and law enforcement data. A critical component are folks that are not utilizing the systems, but are still overdosing and are still being revived by friends and family members. This is another data source, which will give us a much more complete picture of what is happening in our communities. So harm reduction coalitions that have access to this data can easily share with their public health partners, and we can get that data inputted at ODMAP so we get a much more truer sense of what is happening in our communities. Thanks, Carmen.
Okay, well, we're running up against the end of our time here, and I want to ask the producer to pull up the last slide here. Just as one bright note, if you get a chance, please take a look at the conference, the National Opioid Overdose, the National Opioid Leadership Summit that I mentioned earlier, and we'll post that link up on this website as soon as we, in a couple of days, as soon as we get the recordings ready for posting. The closing keynoter on the first day was Regina LaBelle, who has been named the acting director of the Office of National Drug, the Office of National Drug Control Policy, and she is going to be the drug czar. So if you want to get a sense of what the new administration is doing or thinking about what to do about this continuing problem, and particularly I think in the age of COVID, because things changed this year, and we've had an opportunity to think a lot and to gather information about what needs to happen in a new social environment. Please have a chance, take a minute, listen to her presentation. She was about 40 minutes long, and I think she'll give you a good sense of what she's thinking at this point. So we're coming up on the hour. I want to really thank Mark Karandang and Dr. Reb Close for appearing on this session. Great answers, great material, and great participation from the audience. So thank you all.